Back in March, an emergency room doctor in Queens fell sick with the coronavirus after treating a critically ill patient. He suffered for weeks and even months, and though he is back at work, he is still contending with debilitating symptoms. It's an experience that's becoming more and more common among COVID patients, and Dr. Louis Rodkowitz is here now to share his story. And Dr. Rodkowitz, thank you so much for joining us. I'm just so happy that you're well enough to speak with us after going through that hell of the virus. But your story is both harrowing and heroic. So why don't you take us back to that day in March when you contracted the virus and became infected?
Thank you so much, Roma. Yeah, I was working in the midst of the surge, and things were really, really hectic. We were doing as best as we possibly could. And I was intubating a patient wearing full PPE. I really thought that I was protected, and unfortunately the PPE failed, and some of that gentleman's secretions entered my mouth. And about 72 hours later, I was in shock, but 72 hours later, I fell ill.
And as a doctor, you must have known what to expect, what was ahead of you, but was it anything like you were anticipating?
Honestly to God, Roma, I couldn't even grasp. I never envisioned that things would go this way. I became very, very ill. I can't even begin to describe the pain, the body aches, the fevers. My entire body was falling apart. But the worst part of it were the nightmares. Lost my sense of taste and smell. It was nothing that I had envisioned.
And you went, it took a long, long time before you were well enough to resume your emergency room work. You contracted the virus in March, and it wasn't until July 4th that you were well enough to get back into the emergency room, but you're still not 100%, right?
No, not 100%. I'd say right now I'm in the low to mid 90s. I got clearance from all my doctors. They said it was okay to go back, but I have these strange pains in my body. Whole schedule is sort of off, but I've been fortunate. I've reached out to the community, and I've been fortunate enough to be able to get some I guess alternative treatments to get me better.
Well, tell us about that, because I understand this is becoming more and more common, that people are suffering from lingering symptoms long after they first contracted the virus. What did you do to heal yourself?
My story got heard, through social media. My story was heard by folks over at the New York Dermatology Group Foundation, and there are two researchers over there, a gentleman named Mac Hanger and Pete Simonson, and they reached out to me and they said, why don't you, we have this piece of equipment, medical equipment called Juvent, and it's Juvent is dynamic motion therapy. It's a micro-impact therapy that basically stimulates stem cells in your body. And I have to tell you, I truly feel that it brought me from, in the beginning of my recovery, being around 70%, brought me up to where I am now.
Really? If not for this Juvent, do you think you'd even be able to get back to work?
It helped tremendously. I also want to say that I reached out to a colleague of mine who I met at a Lyme disease conference, Dr. Richard Horowitz. He's a Lyme specialist, and I reached out to him after reading a story in the Daily News about how some of his patients that got infected with COVID were using some various supplements. Dr. Horowitz explained to me nothing that was discovering, but it was just basic physiology. My body had sustained damage on the cellular level. And I started some supplements. I've been using the Juvent. and it's been helping tremendously.
After your experience, do you think you'll ever be able to fully recover?
I've had some, I truly hope to God. I'm not entirely sure. I've had some pulmonary function testing, and it showed some lung restriction. But I'm thankful. I do have a relatively good quality of life. I'm so happy to be back at work. The patients, they give me strength, and all the love and concern from my colleagues. I'm very fortunate.
Yeah, I know it's made you reflect on your life. In your first person article you wrote, "Dealing with it has made me re-examine my career and look toward a new definition of each day." How has this changed you?
I'm working on my master's in public health up at SUNY Albany. I was in the middle of a course when this happened to me. They were very understanding, but I think the next 5 years of my life, I don't want to give up seeing patients, but I do. I think the value of my master's in public health and will be tremendous, and I'd like to move towards doing things in public health, helping folks through things like this.
Well, I know you've been helping a lot of folks. You work with the fire department treating first responders and for their PTSD, and I understand you were dealing with your own PTSD. And so, Dr. Rodkowitz, I'm very, very happy that you were able to speak with us, and I wish you a full recovery. All the best to you.
Thank you so much for having me, Roma. Please, if I could just give a message to everybody, take this very, very seriously. Practice social distancing, wear a mask, it does work.
All right.
It really will work.
All right. Wise words. Dr. Rodkowitz, thanks.
Thanks so much, Roma.